This is a patient with cirrhosis who got an MRI for transaminitis. This is a coronal T2. So in patients with cirrhosis, what we're typically looking for um, is, of course, liver mass, because patients with cirrhosis are at an increased risk for liver mass. But there are certain complications of cirrhosis. One is portal hypertension, and here we can see that their patient has um, ascites, and typically we'll see other evidence of um, cirrhosis, such as splenomegaly, varices, things like that. So I'm showing you, there's no mass here, but I want to show you this because this was something that is very easily missed. And I think this is a great example of, of a finding that we don't commonly see on MRI, but more commonly see on CT, but we can see on MRI. We just have to be careful when we look through it. So this is a T2 axial, and if you look at the ascites, ascites is complex. There's loculations here, and you see these little dark T2 dark black um, areas. So things that are T2 dark on MRI, we classically think about are calcifications. That's why stones are bad to visualize on MR. But the other things that are T2 dark is it's actually air. So these are air bubbles that are within the ascites. And I'm going to point out another sequence to you that I think it's important to look at. So diffusion weighted imaging looks at restricted diffusion. And so things that are really thick or dense, like tumors, they restrict. So if we look at this diffusion, you see that that loculated area is restricting. So this is not simple fluid, because simple fluid doesn't restrict. So patient got an ultrasound. So if you look at the ultrasound, this is what you're looking at, these free fluid, pockets of free fluid, and you have these little punctate echogenic foci. The echogenic foci are air bubbles. So this is the ascites that's been super infected, and so they drained out just like tons of pus. So this case is an example of infected ascites. There was no prior CT, so this was initial presentation was on MRI, and so just be careful, because if the ascite looks complicated, you want to look for other things. This patient didn't have contrast enhancement; it was without only, so it would have been very hard to tell. But if you're careful, you can pick up these other findings of infected ascites. So you have air bubbles here, complex loculations, and also restricted diffusion.